Hi guys, thank you for joining me again. This is the second last video of the year. Um, and in this video, I'm going to talk about vicarious trauma and burnout. And then in the subsequent video after this, I am going to talk about self-care, basically some of the strategies to use in addressing burnout and vicarious trauma. Okay, so yeah, let's get into talking about burnout and vicarious trauma. So I'm going to start with burnout. Um, and normally we talk about people experiencing burnout when a person is in a bit of a state of mental, physical, emotional exhaustion. Um, and when they're constantly managing multiple competing priorities and they feel like no matter how much work they put in or what they do, they're not making a difference, or they feel like what's the point of doing all of this, doesn't really matter. So that's the kind of funk, a person who's experiencing burnout is in. It can also happen when a person is working in a job that is misaligned with their values, when they don't believe in what they do, when they feel like they're not contributing, the work they're doing is not contributing to their goals, or they feel like they lack fulfillment, and they feel like also sometimes they're not recognized or ever recognized or acknowledged about their contribution to the work. A major element of burnout is also emotional exhaustion. So a person who's burnt out, their capacity to care is quite depleted for the work they do, and also people around them. They feel there's elements of feeling very emotionally stuck and struggling to, I guess, process multiple emotions. And just to explain this a little bit more, for a healthy person who's not experiencing burnout, what happens is they're able to move within various emotional states quite easily. So you can be sad, but then you can also move to being happy quite easily. If you're suffering from burnout, it feels like you are in a mood, in a bit of a funk, whereby there's a lot of emotional heaviness that people really struggle to come out of, and this is not helpful, and especially in the long term. Burnout happens gradually. As I mentioned, it depletes our capacity to care, capacity to be empathic or compassionate to other people around us, and also to the work that we do. And it doesn't really particularly happen to people of one particular profession. It's basically people in their own professional or personal lives with competing demands or competing priorities, and they're trying to just stay on top of everything. It can affect parents in their parenting roles that they find quite challenging and demanding, as well as, I guess, being professionals or running businesses, or yeah. And also it can also happen to professionals of whether they're engineers or lawyers or doctors, or yeah. So there you go. That's burnout. And the reason why it's a problem, obviously, is because it affects your quality of life, and because it makes you remain in a state, an emotional state that's not helpful long term. All right. So in the second part of this, I will talk about vicarious trauma. So vicarious trauma, as the word says, is a type of trauma, and I have, as I've discussed in my website and also in previous videos. Excuse me. The nature of trauma is that it overwhelms our capacity to cope, and it can cause a person to present in a very chaotic manner in the things they do and how they presenting physically or emotionally. By definition, vicarious trauma is the secondary trauma experienced by people who listen or witness various types of human experiences of suffering. Um, and the person experienced the vicarious trauma, what happens is they almost start to believe that the client's story of trauma, the story of trauma, is their own, and their body and their brains and emotionally they start to have traumatized symptoms. Um, Vicarious trauma is also common for people within the helping industry, so social workers, psychotherapists, therapists, clinicians, but it can also affect first responders, people like police people, paramedics, or people in other medical professionals who treat people who are experiencing deep suffering in their lives through health or in other ways. Similar to burnout, um, vicarious trauma symptoms and effect can be very gradual. And yeah, and of course, there is vicarious trauma is highly likely to there's high likelihood that it affects people who are new to professions because probably they haven't really established skills and resources to deal with the impact of that the work brings on. Um, and the thing about vicarious trauma is that when a person doesn't stop to recognize the impact the work they're doing is having on them, or isn't completely unaware of how the work is impacting them, this lack of awareness or the lack of acknowledgement can have a severely traumatizing effect, and even a compounding effect that causes quite intense symptoms similar to even PTSD sometimes, things like flashbacks or other physiological stress responses, which are can be quite severe sometimes. So it's really important for people to, I guess, remain vigilant and remain aware of the impact of this work and, I guess, their professional selves and personal selves and how that intersect, and yeah, how those demands affect them on a day-to-day basis. You have probably heard of a term known as compassion fatigue. Compassion fatigue happens to especially people who are experiencing vicarious trauma and burnout. It is used to describe the emotional depletion and exhaustion, to a point where professionals and people are struggling to show empathy or compassion in any way to their clients or even to people around them because they're so emotionally exhausted, and overwhelmed and depleted. And this is a major, I guess, symptom of burnout, whereby people are desensitized to things and events that require the emotional presence. So, to explain, I would like to explain burnout and vicarious trauma from a neurobiological perspective. So, basically, how vicarious trauma and burnout affect the body and the brain, because it has very intense symptoms on the body and the brain. Because when we are traumatized, vicariously traumatized, or experiencing burnout, this is when we are experiencing ongoing stress, possibly chronic stress for extended periods of time. We are dysregulated in our body. Our energy levels are off, and we can be flat in the mood in our moods, and in these moods that we really struggle to come out of. People experiencing vicarious trauma have a tendency to mirror their clients' body states, and this is what we call somatic empathy, whereby a professional is joining a client in their state of despair without being able to practice the psychological distance that's required, and which can cause transference, which is also whereby clinician which happens when clinicians and therapists, I guess, of identify with the experiences of their clients or patients. Vicarious trauma also affects a person's memory to a point where people struggle to obviously retrieve information, um, and also obviously their explicit memory is compromised. They struggle to pay attention. They can struggle to articulate what they're saying, and in that presentation, in their speech, they can be quite chaotic. When a person is experiencing uh, vicarious trauma, their executive functioning can also be very compromised in terms of things like planning can be quite difficult. Things like problem solving can be quite difficult. Yeah, so it's not pretty. It's not great. The thing is also within the helping industry, there's a bit of an assumption that we are a healthy bunch. But the irony is of this assumption is that people within the helping industry are the most at risk of vicarious trauma. And while we are trained to deal with burnout and vicarious trauma in our respective trainings, and there's also an expectation that we need to be able to work the mercer to be able to withstand these witnessing of deep human suffering, and hold people coming to us with deep, messy emotions and help them make sense of that. At the same time, we're also expected to work the muscle to hold space for ourselves and the emotions that we experience through our whole experience of, I guess, being therapists and clinicians. The thing is, the expectation that because we're in the business of wellness is an expectation that can be a bit detrimental to people if, especially you're in the field and you're struggling. Um, but at the end of the day, the truth is we are human and we are going to experience really intense feelings from what we hear from our clients. And, we also have um, our own competing lives, personal lives. We don't always, the thing is, we don't always acknowledge our humanness. And sometimes we keep going, and somehow we manage to pour from an empty cup, and these could be intellectualized as, however you want, in terms of, justifying that there's possibly huge caseloads and lots of work that needs to be done. But it can also, this is this can be quite detrimental for our mental and physical health. And choosing to keep going until you crash is really unhelpful for yourself and also for the people who are around you and need you in your own personal life. And yeah, even though we're overworked, and we're growing thin in our own compassion and emotional capacity, and we get to a point where we're burnt out or traumatized, this is not helpful for our own personal lives or professional lives, and it is dangerous. And we need help, so we need to be able to ask for help when we need it. But again, it's also important to acknowledge that when you're in that funk, when you're in that zone, it's really difficult to know what you need. And that's when we need the systems of support that are really important to us. In the next video, I'm going to talk about that a little bit. So I'm going to talk about how we can mitigate vicarious trauma and burnout, and talk a little bit about the process of self-care, because I think it's a process. It's not a one-off activity that we get to do from time to time. So please join me on the next video. Thanks for listening. Um, Please, yeah, comment. Always welcome to comment and ask questions or provide your views. And I will see you in the next video. Thank you so much again for joining me.